Flu cases are on the rise right now in North Carolina, with 12 additional deaths reported.
We have team coverage of the current flu outbreak with Liz Bonus talking about long-term effects. And News 13's Shelly Garzone is looking at the impact on patients and the healthcare providers right here in the mountains.
According to the state health department, Western North Carolina saw a nearly 4% increase in emergency room visits due to flu-like illnesses last week. I spoke with local doctors here at Mission Hospital who tell me they've seen an increase in flu patients this year.
Flu is definitely on the rise throughout Western North Carolina right now. And we're seeing that reflected in all of our emergency departments right now.
Flu season has hit North Carolina hard this year, with the number of cases continuing to increase weekly. Local ERs tell me they've seen this increase firsthand.
Every year in January, we do see a rise in flu like this. So we do anticipate this in the hospital system and try to prepare for it the best that we can.
An increase in cases also means an increase in flu-related deaths, with the state total now rising to 39.
And when we see that type of flu, it tends to be more severe, particularly for older people. And that's what we're seeing right now. Most of the flu deaths that have been reported so far have been in people 65 and older.
According to the state health department, 2,000 people were admitted to the hospital last week for the flu. The week before, it was sitting at just over 1,000 patients. Leaders say this can put a strain on local hospitals.
And a lot of our healthcare systems are running pretty close to capacity at baseline. So you throw in a whole bunch of flu and flu cases and flu complications, it can make things really challenging across the whole healthcare system.
Moore says it's important to remember there are treatments for the flu, especially for those at a higher risk of getting sick.
We want to make sure people are remembering these antiviral drugs are available so that we can, minimize the number of severe cases and deaths this season.
Doctors say normal flu symptoms might not be cause for a visit to the emergency room, but there are some to look out for.
Signs and symptoms to watch out for would be significant dehydration. If people are so nauseous or vomiting where you can't keep down any fluids, if you're so profoundly weak that you can't get around your house, if you're not keeping any food down.
And health leaders want to remind residents one of the best ways to protect yourself from the flu is to get your flu shot. Reporting in Asheville, I'm Shelly Garzone, News 13.